audience.
This is my informative speech about HIV. Did you know that 1 in 6 people with HIV in the US are unaware of their infection? That means out of the 1.1 million HIV positive people in America, over 183,000 of them are not receiving treatment, nor are they protecting themselves, and they're not taking care to not spread the disease to others. Today I'll be talking about HIV and AIDS, and hopefully making more people aware of the facts rather than the myths. I also hope to teach people how to protect themselves and others. HIV is a virus, and it needs a host to survive. Once it affects the host, their immune system is not able to get rid of it. The HIV virus uses the cells of the body's immune system to copy itself. It does not store its genetic information in DNA, but rather in RNA. Therefore, it belongs to a class of retroviruses. Once HIV is in the body, it's there to stay. HIV is transmitted into the body in a few different ways. It can be transmitted by blood, through open cuts, infected needles, and not only street drugs, but medical professionals and patients are also at a risk if the procedures of safety are not followed. It can also be spread through sexual contact. It can occur from contact of any fluids to a membrane or an open wound. It can also spread through pregnancy. It can be spread by birth, breast milk, from mother to child. It can be prevented by a C-section. HIV is not spread through saliva. The first stage of HIV is called primary HIV infection. 2 weeks after the transmission, symptoms will show up. For example, there's severe flu-like symptoms, often described as the worst flu ever. The infection is the most infectious at this point. The second stage of HIV is called the clinical latency stage. At this stage, there are mild to no symptoms. However, it can still be transmitted. Patients can live a normal life, often up to 10 years. Some medications can keep HIV in this stage for the lifetime. The third stage of HIV is AIDS, which is an acquired immune deficiency syndrome. This includes wasting away of the body and also the onset of opportunistic infections like pneumonia and skin cancer. There's also fungal infections. The last stages of AIDS is coma and then death. Early medication can prevent this stage. To summarize, I'd like to reinforce the importance of protection against this incurable infection. Once it is inside the human body, it cannot be removed. And if it's untreated, it can lead to AIDS and eventually death. This can happen to anyone from just one mistake. Remember, 1 in 6 HIV positive people in America do not even know about their infection, so it's important for everyone to get tested, even from a suspected infection. Medication these days can help people lead a pretty normal life, and the sooner it is caught, the better. It is important for information on this topic to be spread, because HIV is a more common problem and affects the general public more than many people think.